Welcome to our video on arthropod-borne diseases. Let's begin. In this section, we will go through the mosquito-borne viruses including dengue, chikungunya, and West Nile. This is a list of each subtopic we will cover for every disease. Let's start with dengue. Dengue is a mosquito-borne disease caused by the dengue virus. It is an RNA virus of the family Flaviviridae and has 4 serotypes, 1 through 4, that can cause dengue infection. The transmission occurs via the female Aedes aegypti mosquitoes and infects humans and monkeys. Dengue is common in the tropics and subtropics. Dengue is classified into 3 major categories: dengue with warning sign, dengue without warning signs, and severe dengue. Dengue without warning signs is when a patient presents with a history of travel to endemic areas and fever, along with 2 other features, such as nausea or vomiting, rash, headache, myalgia, arthralgias, leukopenia, and a positive tourniquet test. A tourniquet test is performed by inflating the blood pressure cuff to a point midway between systolic and diastolic pressure for 5 minutes. The test is confirmed positive if more than 20 petechia per square inch appear on the skin below the antecubital fossa. Dengue with warning signs refers to dengue infection in the presence of life-threatening features. This includes abdominal pain or tenderness, persistent vomiting, third space fluid loss such as ascites or pleural effusion, mucosal bleed, lethargy, restlessness, or hepatomegaly more than 2 centimeters. Laboratory abnormalities like an increase in hematocrit level concurrent with a decrease in platelet count are also considered a warning sign. Severe dengue is the critical phase of dengue infection that presents with one or more of the following: severe plasma leakage, leading to shock and fluid accumulation in the pleural space, resulting in respiratory distress, severe bleeding and assessed by the clinician, or severe organ involvement that includes aspartate aminotransferase or alanine aminotransferase level more than or equal to 1,000, impaired consciousness or evidence of organ failure. Here's an image showing typical petechial rash over the limbs in a patient with dengue. Serological tests can be used to detect IgM and IgG antibodies. Laboratory findings will reveal thrombocytopenia. The treatment of dengue is supportive management with IV fluids and analgesics. NSAIDs should be avoided due to the potential risk of bleeding. Blood transfusion may be required in severe bleeding. Now let's continue with chikungunya. Chikungunya is a mosquito-borne disease caused by the Chikungunya virus, which is an RNA virus of the Tocaviridae family. It is transmitted by the Aedes aegypti mosquito, which is also the vector for dengue. Therefore, a co-infection with dengue is common. Patients mostly present with fever and severe and diffuse polyarthralgia. More than half of the cases develop relapse or chronic arthritis that may persist for months. Some patients may develop a maculopapular rash over the limbs, trunk, and face. Here's an image showing maculopapular rash over the legs and foot in a patient with chikungunya. The diagnosis of chikungunya can be made by serological tests to detect antibodies and reverse transcription polymerase chain reaction to detect the viral RNA. The treatment of chikungunya is supportive with adequate rest, hydration, and analgesics. Lastly, let's cover West Nile. West Nile virus is an RNA virus of the Flaviviridae family. It can be transmitted by Aedes, Culex, and Anopheles mosquitoes. Infection by West Nile virus is mostly asymptomatic, but some patients may present with nonspecific symptoms like fever, headache, vomiting, muscle and joint pain, and maculopapular rash. West Nile infection can cause neurologic dissemination, especially in immunocompromised and adults over 60 years. This may manifest as encephalitis, meningitis, flaccid paralysis, seizures, and coma. Serological test is the gold standard diagnostic test for West Nile virus infection. IgM antibodies against the West Nile virus is detected in the serum or cerebrospinal fluid samples. Polymerase chain reaction can also be used to detect the virus. West Nile infection requires supportive management such as IV fluids, analgesics, and antiemetics. A 28-year-old male is admitted to the hospital due to recent onset of a diffuse maculopapular rash. He recently returned from Africa. He complains of severe headache, muscle, and joint pain. His vital signs reveal a temperature of 40 degrees Celsius, a blood pressure of 110/70, heart rate of 110, and respiratory rate of 17. His laboratory findings are significant for a hematocrit of 34%, neutrophil count of 30%, and platelet count of 100,000. The physical exam reveals rectal bleeding. Which of the following is the most likely diagnosis in this patient? A. Severe dengue. B. Dengue with warning signs. C. West Nile virus. D. Chikungunya virus. This patient presents with diffuse maculopapular rash, headache, muscle, and joint pain. He recently returned from Africa. He has a high fever, low hematocrit, neutropenia, and thrombocytopenia. Additionally, the physical exam shows rectal bleeding, which likely caused low hematocrit. All these findings are consistent with a diagnosis of dengue with warning signs. Therefore, the right answer is option B. Here is a slide that we discussed earlier in this lecture reminding us of the features of dengue with warning signs. Let's discuss why the other options are incorrect. Option A, severe dengue, is incorrect because it is characterized by dengue infection along with features such as severe plasma leakage, severe bleeding, or severe organ involvement, which is not present in this patient. Option C, West Nile virus, is incorrect because it is associated with encephalitis, flaccid paralysis, and Parkinsonian features rather than rectal bleeding, anemia, and thrombocytopenia. Option D, Chikungunya virus infection, is incorrect because it's less likely to cause neutropenia, thrombocytopenia, bleeding, and shock. And that concludes our lecture on zoonosis and arthropod-borne diseases.